long-standing relationship with McCormick Dementia Services. In fact, she used to work at the day programs. So we're so happy to tap into some of Lisa's side projects, or not really side, it's kind of part of who you are, really. And just so you all know, Lisa has a podcast called Capturing Essence for Care, if you're interested in learning a little bit more from Lisa. And that's all I'm going to say, Lisa. You can take it away. Is there anything else you'd like us to know about you?
I'm not sure. I'm sure it'll come up during. It's nice to be here, and I'm so very thankful to be asked to present on this topic, especially Catherine and Tara sort of threw it out. I hope this is okay to say. Like, do you have something along the lines of personhood, something that you could share based on what I do? So, yes, I'm a therapeutic recreation specialist, and I work here in London and Middlesex area. I love my work, and I've been working in this field with older adults since McCormick was one of my very first positions, let's say, after my schooling finished. I've also worked in long-term care, day programs, and in the community and through the hospital setting now, but on an outpatient basis. So I think that pretty much covers it, and I'm just excited to get going. So I'll start by sharing my slides. Would that be a good idea now?
Take it away.
All right, give me a second. I did practice this, so it shouldn't be too hard. And then I just have to, I'm trying this Canva, and I actually might even mention that during the presentation later, but it might not come up. Feel free to ask me questions though, if you like, if you're curious about it. So today we are going to talk about seeing beyond dementia, which is really focusing on personhood, and you might hear the term person-centered care. And what I truly believe is that person-centered care needs to be more than just a term. It needs to be something that we have ideas and methods to help us follow through with person-centered care. So I'm hoping today you will get some of that from this talk. So you'll notice on this first slide that there's a lens, and that's very purposeful. While I'm going through the presentation today, I really just want to focus on, say, the metaphor and the analogy of finding the right prescription. So as we go through, you'll see how I've tied that in, but think about yourself and wearing the right pair of glasses and how important that is. And that really resonates with me these days as I take off my glasses, put on my glasses, and try to figure out when I need them, when I don't. So definitely it hits home for me. Hold on. Let's make sure I do this properly. There we go. So the prescription we didn't know we needed. I wanted to start by sharing a little bit about a lady I met actually back in the day program setting. So this is within the first, say, 5 years of me getting into therapeutic recreation, right after school. And I loved my work, and I still love McCormick, but I loved the atmosphere there, learning from my coworkers, seeing the different creative ways that people think and the way that they implement and develop programs. And so I started in the extended hours day program when I was there. And that was a wonderful position for me to be in because we got to sit in the kitchen dining room in the older building. And during that time, we would have dinner with the clients, and then family members would come and pick their loved ones up. So that really allowed the opportunity for us to get to know the family members when they'd come in. And during that, I was sitting with the clients there, and it was a small group. We had just started the extended hours, and one of the daughters came in to pick up her loved one. And she said, I have this video that I found on my camera, and it was just by fluke. And since we had a nice rapport, she'd sit down and we'd chat over the dinner table. And so anyway, we really wanted to see this video. And it was like I don't even know if it was 2 minutes long, but it was a sweet video of this lady, her mom, who was standing in front of the camera, just chit-chatting to her daughter, who was probably holding the camera, and talking about how she realized one day, like she took the granddaughter to school and she looked down and realized she still had her slippers on. And she howled at herself. And I thought it was the funniest thing. But I think what surprised me even more was the fact that this lady, when I met her at the stage she was at, was very limited in her speech and what she could share with me. And so seeing her in this little old camera, the one you see on the screen was very similar and maybe even older than that, but it did have a video screen that I was able to see her in a different light because it had to be a good 10 years, maybe 15 years earlier. So it showed her red hair, red curly hair, her Irish accent, her sense of humor, her body language, all the things that I didn't see as much now at the stage that she was in. She had frontal temporal dementia, and would ask, "Where's my daughter? Where's my daughter?" repeatedly. And I thought I was doing the best job I possibly could. And I do credit myself and think that I'm a fairly passionate, compassionate, and empathetic person. But I did find that you get frustrated and try to get the person to sit back down. And if they get up, then bring them back to sit down, and she'd have to have her purse with her. So I was focusing on some of the challenges maybe from day to day that I got used to. And I think this video gave me a new lens altogether. It allowed me to see more of the person that I hadn't been able to see with the tools that I had at my fingertips. So that has stuck with me. That's got to be at least 20 plus years ago now. And the fact that that's stayed with me has made me think over the years how important that is, and curious as to why we don't use video more often. So that's a little story about one of the reasons why I talk about this subject today. So, checking our vision is so important. And I love this quote by Wayne Dyer: "When we change the way we look at things," and you can include people here, "the things or people we look at change." And I think the more we know about one another, the less we are to judge one another. So the two bullets on the side, the first one, stories and narratives are the corrective lenses for human connection. And I think I just kind of explained that. Um, just being able to understand more about the person, see them in a different light, helps us to communicate and approach differently in a more effective way. And stories help us bring the person into focus, even as memories blur. And I don't just mean memories for the person living with dementia, I mean memories for all of us. I think the more we're able to focus on some of the positive memories and bring certain familiar ideas into the person's life, the more opportunities there are for us to engage in meaningful activities and have those meaningful conversations. I did write myself a couple of little notes that I wanted to make sure I mentioned, and so far I'm on track. So next, common lenses. So if you think about, like I mentioned earlier, my lenses, I have to go back and every now and then we have to upgrade and look to see how our eyes have changed because they do change. And that's the same with life. So looking at a situation, we need to sometimes question ourselves and think about the way we're looking at a situation or looking and judging a person. So, as I talk through this webinar, I really want to stress the fact that I'm not just speaking about people living with dementia and how we can support people who have dementia. This is for all of us and how we engage and interact with one another as well. And really, turning it back on ourselves on how can we be proactive and preventative for our own healthcare too. So some of the common lenses that I think we develop when somebody's diagnosed with dementia, the first one obviously is diagnosis. So focusing on the dementia first rather than the person. And we talk about the importance of person first, and person-centered language. So that just goes to show that the diagnosis isn't the best way, but that's one that is very common and I mean, yeah, it's bound to happen. Everything is filtered through the loss and decline. The second one says who they were. So that lens is comparing present to past and seeing only what's missing. Medical chart, that's a very common one in healthcare, reducing a person to symptoms, behaviors, care needs. So focusing on just like my own experience in that situation and my story is focusing on, she always gets up, she always wanders around, she never sits down, focusing on the things that I'm seeing rather than really understanding who that person is. So I really want, again, to stress the fact that this isn't, nobody's going to do this perfect all the time, and we're not going to always have the right approach or the most effective approach. And I think it's important and healthy to check in with ourselves and think maybe, is there something else that I'm missing or a piece that maybe I'm not otherwise noticing in this situation? So I've used the medical chart lens before, not happy about it, but it is the way it is. And I think being aware of that helps me to do better in my role. The next one says the burden. So, where every interaction is another task, another responsibility. I think a lot about healthcare in this situation too, as well as people at home who might be caring and loving someone who has dementia and being a full-time caregiver. Also, personal support workers, nursing staff, doctors. There's lots, I think, all people who care or in a caring, supportive role for someone can have this burden feeling, not because they want to, but just because there are so many things in life that things just pile up sometimes. Frozen in time, keeping the person locked in their best or real self from long ago. And I think this leads to that denial piece where, they were that way. And why can't we see that now? Sets us up for failure because they're not able to do maybe some of the things that they were able to do then. And I think that leads to a low mood for us and feelings of resentment and sadness. So I'm hoping today we can talk about some things that give us more hope, give us more tools to figure out how, although we're going to have these lenses now and then, we'll also have a few extra pair of glasses that we can stick on and be aware of when we really need them. So I want to share a little story with you, Kate, who actually might be on the line. And Kate, thank you if you are. And if you're not, thank you just the same, because she's allowed me to share this next story with you. Um, so because I believed so strongly over the years on the importance of and the value I think that videos can bring, I've gone through a lot of different trainings and practicing how could we develop little short videos that could that healthcare staff especially could learn from in order to do better for the patients or the residents or the people that they're working with. So knowing more about a person, regardless of whether that person is able to share their own story in the moment, I think would be so helpful. So my thought was if we had a short video, say under 5 minutes, because healthcare staff especially don't have a lot of time to give to listen to a whole life story. So there's a lot in our lives and we have, anywhere from, well, who knows? I'm going to guess up to 100 years that you can't sum all of that up quickly. And for a healthcare staff to listen to all your stories. So Kate, thankfully, allowed me to practice with her and her husband, and that you'll meet through this video in a moment, was living with dementia, and so he went through a few different transitions, um, and had been in the hospital. And with those symptoms that I showed you before, that medical chart, reducing a person to symptoms, behaviors, care needs, I know that Kate would agree with me when I say, from paraphrasing from her experiences too, that there were a lot of judgments and a lot of stigmatizing, and just experiences that are really challenging when you have a loved one that you care so much for and you want to advocate for them. Yet, what seems to be noticed through the healthcare staff's eyes sometimes is the challenges with behaviors. So the agitation, the frustrations, the irritability. So Kate worked with me to co-create a video. And so even though this story is about her husband, you can't tell someone else's story. So she couldn't tell her husband, who's Seymour, his story, but she can tell her story about who Seymour is to her and her sons. And so I was really appreciative of the fact that her and her boys, their boys, were so willing to work together to give me information, and we created a little bit of a story and a video to go along with it. So I'm going to share that video with you now, and you will hear Kate's voice. So this was a project that we did over a few weeks. I think it was 6 weeks. And we've continued to share this story whenever possible. So you'll learn more about Seymour. Just take in, see what you learn from the video, and then we'll have a quick minute to reflect after.
Are you set? Okay, 3, 2, 1, go.
This is about Seymour. He's a wonderful husband, hands-on dad, a great Zeta, loving son and brother, respected teacher, scholar, tennis player, and peer. He's so much more than what we see now. I just don't want him to be remembered by the late stages of dementia. I want him to be remembered for the amazing man he is to me, his sons, certainly his grandchildren, and everyone else who knows him. Our boys wrote down their memories of their dad to help me prepare this video, and I was very surprised that neither of them spoke of Seymour's obsessive-compulsive tendencies. I don't think they ever saw it, or maybe they just didn't want to see it. Yoram, our first son, calls his dad Papa. He wrote how he remembers Seymour always jotting math on paper, any paper, along the margins of the newspaper even. He said that it seemed like a foreign language to him when he was younger, although he was very good at math as well. Michael, also good at math, also mentioned how very meticulous his handwriting was, and that Seymour's quickly scribbled equations were actually quite beautiful. He wrote the funniest and sweetest of love notes to me. He actually loves me warts and all. Seymour has always loved numbers and math. He also loves grammar and frequently would change the grammar when the kids were writing his parents, which bothered me. I wanted the notes sent the way the kids had written them, because I think it's more authentic. He loved joking around too, and enjoyed making up his own jokes and puns. What continues to make us smile even now is how much Seymour loves music, and can still sing along with some of the songs from his youth.
Is that the Chattanooga choo-choo on track 49?
And when I'm doing his feet, I play the music, and he loves it, especially old ones. When the kids were little, he'd shoot elastic bands at Dixie Cups with them, sometimes with Star Wars action figures standing on top of them. He told the boys that they were cowboys camped up on the rocks. It absolutely drove me crazy because they were so noisy about the whole thing. He was supposed to be putting them to bed, to sleep. And then with grandchildren, it's like he became a kid again. Seem just had this way about him. He drives me crazy, and I mean crazy, but I just couldn't love him more. He stands for honesty, integrity, fairness, and fun, and brings out the best in me. But he also, I used to be really upset when he didn't take my part. He always wanted to hear both sides of the story and both sides of the argument, which really bugged me, because I said, you only listen to my side. Most of all, though, Seymour stands for love. I want people to see him the way we do, and always will, no matter where this journey leads us. He loved us unconditionally. He really did. It was just... it's hard.
You do really good work.
Now next
Yes?
This is almost like
Okay. And you're done then?
Huh?
Well, thank you very
I'm
much.
going to my
Go for it.
Oh, that video gets me every time. And this is the time where I would normally stop and have everybody share even a word on how they're feeling. So I guess feel free if you can mark in the chat to Catherine and Tara, feel free on how this makes you feel. And if you don't, that's okay too. What I have found through sharing the story and through the video and through presentations is that sometimes there's a bit of a long a longer than I anticipate of silence. And what I've come to learn is that that's because of the emotions that come up and that people are so touched that it's hard even to speak. So I hope that you got something from that. And Kate, thank you for sharing that video with us. Catherine and Tara, I see you popped on.
Yeah.
Just thought I'd check in.
So I was
Yeah.
just going to say that the chat doesn't work with the webinars, but the Q&A does. So if people
Okay,
have comments or questions as the presentation goes, yeah, if you enter them in the Q&A, and then Catherine and I can read them out.
perfect. Thank you for clarifying that. So yes, I'll read the questions out and then we're going to move along. But definitely I wanted to show you the impact that hopefully you felt, and that's how I felt when I saw, maybe not quite to the same extent, the video 20 years ago that stayed with me. So what resonated with you from this story? How can you relate to this story? And how did the video make you feel? And I want to point out that those are questions that you're probably not going to ask when you're reading a chart or, or even looking at a personhood tool. So you're not going to think about, whoa, that really touched me, or I can really relate, maybe every now and then. But with a video, there's something different. And we'll talk about that a little bit more.
Absolutely. And we won't mention any names because we want to keep respect confidentiality. But one of our participants has shared that the word that came to them was bittersweet. And I definitely
Mhm.
resonate with that. It's such a profoundly moving video.
Yeah. Thank you for sharing that. Yeah, bittersweet. Yeah, very important. And I think it's also okay for me to share that um, that video was later used in a celebration of life. And so it's created a lot of wonderful sentiments and to be able to share. And I don't know if you picked up in the video, hopefully you did, that Seymour was a teacher. And so this, from Kate's words, is allowing him to still teach, which what a lovely way to see that and to feel like he's leaving a legacy by sharing this video. So to both Kate and Seymour, I think it's a wonderful gift, and I'm just grateful that the whole family were open to it. So yeah.
We do have a few more comments, Lisa, that have
Okay.
come in. So one person says that the message that resonated with them the most is that they do want their partner to be remembered by the way they were, not by their dementia experience.
Yeah. Yeah. Absolutely. 100%. And I feel the same way. And I think that's in those different lenses that I mentioned earlier, we can see that and want to hold on to that, but things do change. So I think it's really important to capture what you can, before we move along, but also for us. Like, I don't think I think we need to maybe wake up a little bit and have more awareness that this could be any of us. And it's really, as I think about these videos and think about capturing our essence, the reason I have a podcast is it could be anyone. And it could be for cognitive reasons, it could be for physical reasons, it could be for emotional reasons. And we never know how long or short life is. So we might as well, just take matters into our own hands and capture what we can now at any age. So
So
I
I'll
could,
read a couple more comments, Lisa, that are there. Another
okay,
person says
thanks.
what resonated with them was the obvious love that Kate has for her husband and that she still celebrates who he is.
Absolutely.
And another participant just said that they can really relate to the story and that's where they are at the moment. So, oh, a few more too. They're coming in here. Definitely a wonderful gift making the video, and to use it at Seymour's celebration of life is pretty powerful. A valuable video. Every dementia patient should have one. So,
Mm,
yeah.
thank you. Thanks for sharing. So, you'll probably see by now a picture, you've heard this before. A picture is worth 1,000 words. While I was doing my research, I found that 1 minute of video is worth 1.8 million words. Isn't that incredible? And I did the math on my little notepad here. Let's see if I have the right. So that works out because I'm not great at math. That works out if it's times 5 minutes or under, it's somewhere under 9 million words. So that's a big difference. And of course, that's because there's so many other areas of our brains that are being connected. You've heard neurons that are firing together, wiring together, fire together, and this is allowing us to do that by sharing in a way that captures us. Think about this, the videos that we watch, like the movies that we watch, the books that we read. It's all around story. And when you're talking to a friend or a family member and they are telling you this intense story about something, whether it's exciting or sad, you're right there with them and you're feeling the emotions they feel. And that's because our brains are actually connecting. There's something called neurocoupling and mirroring. So it's scientifically backed that stories really help us to capture and understand information in a completely different way. So why don't we use this more to help us with personhood? So the final message for this piece is use video whenever you can. And if you don't have videos, so I'm guessing you do. If you have a cell phone with you, you probably have little clips on there. Even some of the images move if you hold them down. You'll see that there's some motion behind them. And then also, same with like I showed you that one from 20, 30 years ago or mentioned it. Like we've have video clips and they don't have to be like what I just showed you with Kate's. It doesn't have to be so finely organized and structured. So using what you can, and you'll notice in Kate's again, there was little video clips from the sons with the grandchildren. So use what you have, and then we can stick it together somehow. Or use still images and then, with a voiceover music, other elements, which, yeah, that's what I do. So think about the purpose on why you would create or capture your essence and why that's important to you. And that could be for a lot of different reasons. I jotted some of them down here. Maybe it's just for fun. Maybe it's just an activity that you want to do. And so remember, this could be just simply using your phone and recording and looking through videos or capturing a person's voice as you do it. It could be for advocacy. So maybe you're advocating for something or trying to express a concern about something. It could be for passing down to future generations. I think often family members reach out and they want their grandparents' stories captured or their parents' stories captured to share with new home care companions. So if there's, you're starting to have people come into the home to help with some respite, caregiver respite, so you can get out, then it's helpful to have something that new home care friendly companion can use to get to know that person better. Also, deepening understanding and rapport with others. So, in new settings, in transitioning to retirement home, hospital, long-term care, and not that hospital's forever, but if there's somewhere new, wouldn't it be nice for the healthcare staff to see something like that? It could be, like I mentioned, in preparation for a move, or maybe just that feeling of urgency. I actually did a story with my mom, and she said it feels like a bit of an insurance piece. So she'll carry it in the pocket of her purse. Just knowing that she has it helps her to feel, comforted that she has that in case she needs it. So I like that idea too. So now I'm going to switch into the five, it could be four or five forms of communication. These are methods that work so that we could say that this is your lens care kit to go with our eyeglass theme. But my point is, all of that video stuff, I'm going to not mention video so much now, but I want you to keep that in mind because all of these ways that I'm going to share about communicating, the next few slides are going to give you ideas on what you could do if you wanted to capture essence through interactions, through um, any type of activity. You could capture that through video. So as I go through, keep that in mind that they're connected that way. So verbal, nonverbal, written, visual, and listening. And the pictures I thought were kind of cute. Thinking about, when there's so many charts to read or lots of information, or thinking about if you're seeing it for healthcare staff, I think about when you see so many people, you don't want to confuse the information, where I feel like when you see something like a video or personal pictures even, I'd love if everyone showed me pictures and shared about who's in the picture, even if it took a couple of minutes. So keep that in mind. There's nobody else who can replace you or your loved ones. So some verbal methods that you could use to engage a person and really highlight who they are is some things you'll see on the side there, but I also wrote some examples. So conversation, just simply having conversations with someone. So you'll notice in the picture, there's little conversation prompts. You can easily Google conversation prompts or conversation questions, all about me questions, icebreakers. There's lots of different things that you can look up and find free tools for. So none of these have to cost much or anything at all. Other ways that we verbalize and show communication that way is just speaking. So conversation is two people. Speaking is more like, say, public speaking, like I'm doing right now, communicating something to you. Singing is another form of communication, telephone and video calls, and using familiar objects, music, or locations to spark memories. So I would say for all the next slides that I show, think about the familiarity of objects, music, locations, the person's environment, not just what's in the environment, but also including the people in that environment. So as we talk about when there's responsive behaviors or expressions of risk, there's a few different ways we can say that now. We say in our healthcare world that that's always due to an unmet need. So when there's a responsive behavior, that's due to some form of an unmet need. And so the behaviors are actually that person trying to communicate their needs in some way. So they're communicating that something's wrong, and we're trying to figure out what that is. So remember, these five forms of communication are ways for us to really understand how a person's trying to communicate to us. So that could be verbal, it could be nonverbal, written, visual, or listening. So I gave you some ideas. The familiarity here, I thought, games and activities by having a deck of cards if somebody plays cards or played games, or maybe they, were a carpenter and worked in I don't know, making coffee tables and furniture, but having things to talk about, or maybe some of their old items that they've built before. So being able to ask questions or, show curiosity and ask more about when they learned to do those things or how they learned. Asking for their advice helps them to verbalize their thoughts and opinions, and that might be something that you want to capture. Sports. So I just gave some ideas. We could go on and on, but lots of ways that we can have verbal communication with one another. Again, make it fun, make it a game, make it failure free. Those are going to be your keys to helping a person feel like if there's no judgment and I'm not going to mess up here, then I feel more open to sharing information or just being themselves. So some nonverbal, that's number two, nonverbal modes of communication. Think about a person's posture, like I explained with that video at the beginning. seeing her stand there and hearing her sense of humor, her laugh, her smile. These things all matter so much, and I think we forget about them. We tend to take them for granted and don't necessarily think about the way we communicate non-verbally. Facial expressions, body language, tone and volume of voice. If I say yeah, that's one way to say yes. But if I said yes, it would be a totally different tone. So understanding, even though that was a verbal, but I could say mm-hmm, and then do something else, and you would get a completely different take on it. So knowing that we have to really observe a person, not just what they say. Their appearance can say a lot about a person. How do they look? Their personal space, what's the environment around them look like? Their posture and the environment, like I mentioned. So I put pictures always because it helps me to think of ideas as I share with you. But things like the nurturing roles too. If somebody loves children, it might be great to have baby dolls to communicate with, capture that moment where you see them holding a baby doll, or intergenerational activities where you have grandchildren over or children or school age. Also, yeah, I showed you the intergenerational there at the bottom. Touch is important. Thinking about nurturing roles too. So not just children, but you can think about pets, animals, and also plants. I didn't add that on here, but thinking about somebody who loves horticulture can be a different way. And just as important that that person's nurturing something and keeping it alive and nourishing it by watering it and feeding it and making sure that it's in the sun and so on. So those are all purposeful roles that a person can really feel like they're giving back in some way. And then also appearance. So it could be things like hair brushing and spending time on just the appearance piece, doing nails, foot rubs, hand rubs, and so on. So this next part, I didn't add so many pictures, but I could have. But the written piece, like I mentioned before, all about me and personhood forms. If you look up either of those phrases, you'll find lots. There are so many. Also, before I'm going to share a little bit more about a personhood form in a second, but also thinking about if a person wrote letters or you've written letters, or maybe I know that our family has something called round robins where we used to have a letter go through all of the different family members, no matter where they lived in the States, in Canada, in British Columbia. It didn't matter. This one letter would make it through, and then you'd take your old letter out from the last time you had it and add a new letter in. So think about the handwriting and things that are at your fingertips already at your homes, in your environments. Journals, memoirs, notes. I keep a day planner. I make a day planner, and everything is in there. So I'm sure a lot of people have journaled. Also thinking about poetry, music lyrics, so writing music possibly. Looks like I put day planners in there twice. That was pretty selfish of me, but that was because that's important to me. And also recipes. So if a person was a good cook, thinking about those old recipe cards with the handwriting on. Even in Seymour and Kate's video, you'll notice that we added some of Seymour's writing and some of his little math equations. Those are things that are unique to him, and those are wonderful things to be able to capture. So the written part, the image that you see there, I'm going to fast forward to the next screen because I have it there again. This is the My Personhood summary, and you can find this on Brain Exchange. At the end of the slides, I do have a reference slide, and it has a link to it in there. You can download it for free. It does ask for your name and your email. They don't send you anything. That's strictly just for research purposes to see who might be downloading that and who's seeking that information. So, for example, is it a healthcare professional? Is it a family member? So that's the only reason they're doing it, is because it helps them to better identify the purpose this serves. So I was on the working group that helped create this and modify this until we had it the way we wanted it. The My Personhood summary is really a wholesome document that if, say, a person does go to long-term care, this is something that could be shared with that long-term care home. But it's also wonderful just to have and go through with the person so that you can both kind of go through, think about the things that are important. I'll read out some of the questions. The font is pretty small on here, but feel free to go and download your own copy and review it. They also have a resource called Guidelines for Use. Excuse me. So it will go through and give you more information on the questions here and what you might need to fill that out. So everything from preferred name, language, sexual orientation, gender identity, and then it goes through things that I am good at and or best known for. Sometimes we have a hard time thinking about the things that we are good at. So it might be more things that other people say we're good at that we're able to speak on. The following people and pets are important to me, so you'd add those names down. And so this is a guideline. So you can add whatever information you want, but you also don't have to add information that you're not comfortable adding. This is just an extra tool for you to think about questions that might be worth answering or jotting down while you're still fully in control on doing that, or have a loved one who will join you and you can do it together. Daily routines. It talks about what do you believe and practice. So considering cultural, spiritual, religious, morals, values, and traditions. Daily routines, and then the past. So we started with who I am now, and then about my past. So the second part of that first page, where I grew up and lived. So notice it doesn't say, where was your home or what house did you live in? Because everybody's living situation is different. So where I grew up and lived, that's more of a location, not so much what does that building look like, because maybe it wasn't a building. Building types, communities, cities, so you can describe that in any way you want. Who I spent time with, so that could be relationships, your family history, how I spent my times, meaning life roles, occupations, my high points in life, so you can add what you want there. It could include events, achievements, experiences, significant dates, and low points. So sometimes people wonder, I don't really want my low points there, or I wouldn't want to post them, because this is something that you'll notice on the bottom right side. If you were to complete this and give consent to have it posted, then that could be something that would help, say, care staff to be able to have a quick read and know some of this information. But it doesn't have to be everything on here. You could just have a section that says, please refer to the chart for more information. So the right-hand side says your social, emotional, and environmental preferences. So considering it gives you examples there: hobbies, interests, sources of comfort, discomfort, affection, and then environment includes use of sensory aids, considerations for personal space, and placement of objects, and then other things you should know. So this doesn't have to be something that has to be posted, but it's just an idea. And you don't have to do it just like this. You could create your own, but the idea of giving some information and thinking about the things that you could capture, a way to capture essence, is really helpful. I often hear about how in long-term care, people don't have consent to post an all about me. So that's why I think it's so important to make sure those things are discussed on, would it be okay? Maybe this is something that we're okay with posting, or even just the daily routines that are important. So number 4 is visual. How am I doing for time? I think I'm okay. So visual, thinking of different ideas like pictures and photography. I know that today, even going on a visit, I asked, do you have any photo albums around? I just want to see more about your family. So that's a great way to open up dialogue and have more of a conversation. Having props around and going into somebody's home, I am so privileged because I get to see the pictures on the walls, the figurines, the things that they've done, the things that they enjoy, the things that they surround themselves with. Also, videos can be really helpful. YouTube, well, that's why there's a play button in the middle there, but pulling up YouTube to watch bloopers, for example, ambient scenes, just seeing if a person loved to travel. It could be pictures of Greece, of Scotland, like wherever they might have gone that they enjoyed, or maybe their home of origin. Painting, sketching, drawings, these could be under maybe writing as well. But these are opportunities and platforms for a person to really express themselves in a visual way and also receive information that way as well. And so sculpting, I added other pictures here. It could be through taking pictures themselves, not just looking at pictures. It could be looking through a scrapbook, but it also could be scrapbooking and going through and doing the crafting piece. So lots of ideas. These are just some of them, but there's so many more. And then this last one. So when I was doing research on the basic forms of communication, the first four were often listed, and then there were a couple that said five. And I thought for the purpose of this webinar that it was really important to add in listening. So yes, there's the verbal and the nonverbal, but it's also really important that we listen. So listening wholeheartedly, the just being together. Sometimes there's no words. Sometimes there's nothing you can do in any moment, and it's just the being together that works. Paying attention. So paying attention to those nonverbals that we might see, joining in an activity together, listen to understand rather than to respond. I'm pretty sure Stephen Covey said that, and to connect emotionally. And again, just being together, if we can take the judgment out of it and reduce our expectations, I think we get a lot further. So the right prescription, I think about myself with driving at, I don't know if any of you have had to get up at 3 a.m. and drive anywhere, but wow, I realized that I really need a pair of glasses now to be able to see properly at nighttime. So having the right prescription, and that could change based on a few different things, is really important. So in this case, the lens we want is the person-centered lens. And we're going to have different focuses and zoom lenses maybe that we need to use. So the essence lens, the primary prescription, seeing that whole person, the essence of the person. The present tense lens is our adjustable focus. So just being able to think about the here and now and what we can do about that. And then really zooming in, that zoom in capability of these moments matter so much. So even though we're so close to them sometimes that they can be very stressful and they can lead to burnout. And I think being aware of that and removing ourselves when we need to is really important. And I also think that sometimes those little moments matter so much that we're able to see beyond the challenges if we're able to remember the full essence of that person. So hopefully through this talk tonight, it'll give you a few more ideas to try. And in case you needed any more reasons to consider capturing essence, there are so many benefits of sharing stories. And these are just a few. It significantly reduces depression. It enhances quality of life, strengthens communication and connection, preserves identity, not identify, and personhood, builds deeper relationships, and shifts perspectives. So it helps people to be seen more as people rather than patient number one, patient A, and really understanding that there's more to us than what meets the eye. So if I could leave you with this idea, start where you are and use what you have. So this doesn't mean go out and do a big project. All I'm suggesting is if in the next 24 hours to 48 hours, you could capture one story or one question or one voice message or one memory or one moment. And it doesn't have to be through video. That's just my idea that I think is really helpful. But if you took some time just to try out one of those things and find out information in one of those ways, I'd love to see what happens. So that's it from me. Thank you so much. And yeah, I just appreciate so much being here. So thank you again. And I'll stop sharing. Tara, is that a good idea? Yeah. Oh, and before I stop sharing, there's my references at the end. So there's a lot of them, but feel free to connect with me anytime if I can explain. There.
Wonderful. Thank you very much, Lisa. Great
Thank you.
presentation. So I think we do have some time for questions. So if people have questions or comments, if you put them in the Q&A, so at the bottom of your screen, there's a little Q&A square. So if you click on that, you should be able to type in your question or your comment, and Catherine and I will both take turns reading them out. So I think we've got something in there already. Oh, someone just asked, did you have the references? So we do have the references. So I don't know, Lisa, are you okay if we send out the slides to people or the
Yeah,
references or?
you can send out the slides. I just will take out, I think you have the one without the video included, so you can send those out. Or I can also show them on the screen again in case you want to take a picture of them for.
Okay, yeah, that's a good idea, actually. And then people
Okay.
can take a picture, sure.
Okay, let me share them one more time with everyone. Oops. There you go. Where do I put?
Okay. All right, so maybe while we're showing that, we'll see what other questions are here. So just a comment thanking you and saying this was very helpful. Another one, thank you for all the valuable information. I'm looking forward to taking videos. That's something this person had not really considered before. So yeah,
Yeah.
videos are great, aren't they?
Yeah. And so I should add too, because I don't think I talked about this too much, that the reason for sharing videos. So some people think, oh, like, do I have to share them with everyone? Who you share videos with is completely up to you. So they don't have to be shared publicly. They don't have to go for everyone to see. They're just for sharing with whoever it makes sense to share them with. So Kate, thankfully, is quite happy to have me share Seymour's video this way. But a lot of people just share so that they have it for their own family. So it doesn't have to be something where the whole world sees. And I think knowing that the purpose of videos is more than just people think, oh, nobody wants to hear about my story. Well, they do, but if that's not enough, do it just because it's important for yourself, for advocating for yourself. So I think there's different reasons to do them. Sorry, that was my last little blurb.
Okay, that's great. So yeah, lots of comments. Beautiful presentation, Lisa. Good presentation, and definitely makes one think about new ideas and approaches to dealing with dementia. Okay, question here. Have you or can you put video on digital frames?
Can you do video and digital frames? Great question.
Hmm.
And I don't think I know the answer, but maybe I'll see if I can find out. Um, but yeah, I'll be very open and say I really don't know.
Yeah, I'm not sure either about that.
And one participant would like to know, is it possible to get family members involved in some of the webinars such as this one? 100% yes, just reach out to us. And this webinar is being recorded, so you can share it with them that way once it's up on our YouTube channel.
Yeah.
All right. More thank yous, lots and lots of thank yous here, Lisa. We'll let you read through them after. Just comment. Yeah, so many great ideas to honor someone's life and all those who contributed to their life. Great presentation. Oh, someone said that they found the pets or the dolls, like you're talking about the baby dolls that you can get, very helpful with the person they're taking care of.
Wonderful.
Okay. I don't see any other questions right now. Another minute. Okay, here's a message from someone. Okay, so this person says, such a meaningful presentation. A few years ago, their husband with early onset was fortunate to have been an honoree family for the Walk for Alzheimer's with the Alzheimer's Society, and they did a video there. Yeah, so they've got a video from there, and but they never thought to show them to the staff at the long-term care facility. So
Mm.
yeah, great ideas, right? It is
Yeah.
so helpful for staff to get to know people and to see, their life, right? And what's important to
Right.
them, those things.
Yeah,
It's,
and
yeah,
I
it's
know Kate has mentioned that too, that it was really helpful when Seymour was in long-term care, that it really opened the eyes. And they continue to use the video, I believe, for education purposes for volunteers, and anybody who works on that unit where he lived. So it's, yeah, they can be very educational and things that we didn't necessarily think of before, right? Like different ways that they can be used.
yeah, absolutely. Great. All right. Well, I don't see any other comments, so I guess we will wrap it up there. Thank you so much, Lisa. Wonderful presentation, very
Thank
informative.
you. Thank you so much. It was a pleasure to be here for sure.
Yes, thank you all for attending, and we'll stop the recording now, and we'll say goodbye to everyone.